Jay.
Hi.
Cheers.
Cheers.
Hey, it's nice to see you again. It's been
You
so
too.
long.
I know.
You're still wearing the same
I
clothes.
am,
It's
even
a
though
week
it's
later.
a month later. It's still green, still on the same beer.
I know. We're winding our way down. I'm just drinking kombucha today because I have a patient at 1 o'clock, so I won't be day drinking today
Right.
until after 2:30. So we've been talking today. Well, again, I'm Megan Cranenberg. I'm the owner of Chrysalis Physical Therapy and this YouTube channel, as well as Crane's Castle Brewing here in Bremerton. So this is the Pints and Pelvic Health podcast. We've been talking for the last 3 weeks about male pelvic health. And Jake, how are you connected to that?
I'm Jake Bartholomew. I'm a physical therapist in Seattle, Washington. I treat almost exclusively pelvic health at Flow Rehab in the Fremont neighborhood.
Cool. So if you want to learn a little bit more about what Jake does, go back to the last 2 episodes or the last 3 episodes actually to hear more details on the conditions that he treats and how he works with that. And we've just had it's just been great to meet you, and thank you for braving the ferry boat today to make it over here.
It's a perfect day to be out and come across the water.
It was beautiful.
And to meet you and see your lovely brewery.
Oh, thanks. Thank you. This is a pretty fantastic place. I love kind of having the brain working in different ways here at the brewery versus at the clinic. It's still people. It's still working with the community, but I don't have to write notes or send treatment plans to doctors. So I feel total. And people are so happy to just buy a beer. So I want to use this last session today for us to just powwow about stuff that just keeps us excited about the work that we're doing, like not necessarily related to any condition that you treat, but just how do you stay fired up in a profession that kind of has high burnout rates?
Yeah, that's true. Well, switching gears from when I was just doing outpatient orthopedics, switching into pelvic health was an exciting change for me and helped prevent burnout in that regard. And now within pelvic health, I've been doing that 10 years, and it's still staying kind of fresh and new to me. I see new conditions all the time or just different presentations. And it's just so rewarding helping these guys that are coming in with chronic pain and felt like they had nowhere to go, and try to give them some answers and let them know that they're not the only person with this, and help them decrease their pain or dysfunction, whatever they have. So that's one of the big areas. And then the other thing is I've been trying to really market more towards the transgender, the non-binary, the sexual fluidity type population out there, because it's so underserved, underrepresented, and there's so much prejudice against them, and they're treated poorly. And so I want them to know there's a friendly person out there. If they have any sort of issues, I'm happy to treat their shoulders and necks and knees even.
Absolutely.
Just because I'm not going to judge. I want them to get treatment, and I don't want them to avoid the healthcare system because they're going to feel they're going to be judged or called the wrong name or the wrong pronoun.
Yeah.
But I feel this patient population especially could have pelvic health issues, regardless of whether they had surgery or not. I think it's just an area where they might be holding a lot of tension. If you feel like you're kind of born with the wrong genitalia, you might just be holding a lot of stress and tension around that. And I really want to welcome them in and say, hey, let's talk about it, address it. Can I help that and decrease their pain or their issue somehow?
That's fantastic. I think about, like, in Eastern medicine, just the idea of I talk about the root chakra with clients a lot. You know, I'm not Hindu. This isn't necessarily my cultural of upbringing, obviously. But whether it's Eastern or Western medicine, there's a lot to be said about kind of looking into other traditions and what does it have to say. And in the chakra tradition, the pelvic floor is your root. Your sense of self arises from that, your self-identity. So, I can only imagine that kind of that intrinsic conflict if that root chakra is in limbo or conflict, until that's resolved and you feel supported in that. So
absolutely.
Thank you for doing that. And same with me. It's not a population that identifies themselves to come work with me often, but I hope and pray for that. I definitely, it's out there to the universe. Let me know. Cool. Well, you were talking about that. It made me, it's kind of a nice segue. I was going to talk about our combined sections meeting. The American Physical Therapy Association does a huge research conference every year. This year it was in Washington, D.C. back in January. You were there?
I was there.
I was there.
It was very cold.
It was very cold. It was beautiful.
It was beautiful.
And it was quiet because it was still during the shutdown.
Yes.
Yeah, very much.
Couldn't go to any museums.
I know, that was a bummer. I walked out, I did a long walk on the last Friday, and I went out to the Lincoln Memorial because that was a huge bucket list item for me. I hadn't been to DC before.
Yeah.
But did you attend the session on post-operative considerations for transgender?
I did. There were two. There was a
male to
pre-conference full day.
Oh, that's right.
That I went to, and then I went to the shorter one on Friday. I believe.
Yeah, I went to the Friday course. I was at the endometriosis course during the transgender course.
Gotcha.
So. That was just really fascinating to hear the surgeon that presented on it. That was
how they do a phalloplasty or vaginoplasty was absolutely.
I only saw the vaginoplasty,
Gotcha.
so I didn't catch all of it, but that was nice to see just the conversation really happening, and nice to see the surgical techniques, because if we don't understand what happened in the surgery, it lengthens the time. We're kind of playing like we're navigating by the stars instead of having a really highly technical instrument panel in front of us to figure out where do we need to direct our treatment. So.
Exactly. Yeah, we need to know what happened to how to help them heal and move on and move forward and use their new body part successfully.
Exactly. It was just it had been 8 years since I'd attended a combined sections meeting. My son was 3 months old the last time I went, and so I wore him in a Moby wrap and walked around New Orleans with attending all my sessions. And of course, I hadn't really started doing any work in women's health last time, and so it was really interesting to kind of go, reflect on 8 years ago, the information that seems so revolutionary to me. Oh, the breath, the diaphragm and the pelvic floor, like our breathing mechanics, they matter. And this year, going back, with a few more years under my belt, going, okay, we're still talking about the diaphragm and the pelvic floor. Okay, that's great. Like moving around, and what was exciting at CSM this year, not just, the women's health coursework was great. There were so many students attending.
Yes.
There was a course on coaching pregnant and postpartum athletes, and I swear half the room were students, and it was there were probably 300 people in that lecture hall, and it was so many students and guys showing up.
Yes. A lot of men in we have to refer to them. They're the women's health courses because it's at the moment still called the section on women's health.
Yeah.
But all these pelvic health courses fall under that umbrella. So, but it was great to see all these men and students at these pelvic health courses and interested in it. It's really encouraging.
Becoming more mainstream and something that the physical therapy education world is looking at. Possibly implementing a requirement for entry-level physical therapy education to address pelvic health. And I think that needs to happen because, as healthcare consumers, people can go to a great personal trainer to get better at their lifting technique. They can go to a great massage therapist for fantastic manual therapy work. If we're going to, I think, stay relevant and really keep our profession at the top of its game, like pelvic health, I think, is at kind of at the tip of the spear.
Yeah.
About how we're the crossroads of the nervous system and the endocrine system and the musculoskeletal system.
Absolutely. And besides just treating pelvic health patients, don't you feel like you're a much better orthopedic patient?
Oh, heck yeah.
Physical therapist overall, based on knowing this. Like, you're not afraid to treat a high hamstring strain now, or groin strain, or ab strain, or anything. You have so many more tools in your tool belt to help those people, and not just pelvic health patients.
Exactly.
So I'd try to encourage all orthopedic therapists to take some pelvic health courses and make them a better orthopedic therapist.
I was back last summer. We were down in Oregon visiting my husband's family, and his brother is an orthopedic spine surgeon. And so I was talking to Andy about the recent training I'd had in visceral work, so with Ramona Horton's classes, who happens to live in the same town as my brother-in-law, where he's a surgeon, right? And so they're like right next door to each other. And I was like, Andy, like this, this training, this visceral work is amazing. The changes I'm seeing with endometriosis-related pain, with bowel dysfunction, And like, even like last week, I have a new client who had SI joint pain, and it's not her SI joint. And he's like, it's her hip, right? It's her hip. I'm like, no, it was her cesarean scar from like 30 years ago. And then laparoscopy scars and all that skin tissue. Like, we can't just look in like the 2-dimension, and it's not just joints and ligaments, but that uterus, like, Andy, the uterus attaches to the sacrum. You're going to have referred pain from these internal structures. And he was just like, that's cool. But how do you figure that out? Like, you palpate or you reproduce the symptoms. And he's luckily is a really like open-hearted, open-minded surgeon going, yeah, I need to go talk to Ramona again about some of that stuff. And then when I saw Ramona at CSM, she gives me this huge hug and she's like, you're her brother-in-law, listen to you. And just she starts telling me kind of a little patient case that we sent off to her, because it helps get that conversation going in those channels. But we're kind of, I think, at the forefront of really effectively treating low back pain and SI pain, because we're looking beyond just those. Right.
And we have ligaments. To educate those referral sources still. And luckily, sadly, you needed to know someone personal to do it. That brother-in-law, full disclosure, my husband is a GI doc. And so he's been learning so much more about this because of me, but I don't think, hadn't been very aware and wasn't super open to talking about muscular dysfunction for his constipation patients or visceral issues for his reflux patients. But he's so much more open to the world of pelvic health and how treating these muscles and bones and ligaments and tissues can really help a lot of his patients that maybe just medications or other treatments in his paradigm hadn't been successful with.
Exactly. It's again, that's the accessibility thing, and I have a love-hate relationship with that particular topic, especially as an independent practice where I need to be marketing, I need to be out there talking to docs, and sometimes just getting past that, nope, that's not what I was taught in medical school or in residency. I have a friend who's an OBGYN 4 years out of residency, and they were still taught in her residency program that physical therapy is minimally effective for urinary incontinence. And my jaw hit the ground. And I had to tell her, I said, I've never had a patient ever who didn't either completely resolve their symptoms or get considerably better to a point where they're like, if this is my new normal, I am ecstatic.
Exactly.
And it's like, how is that? And it's, go back to the first episode where we talked about research. It is difficult for our profession.
And how to measure, and
how to measure. So
exactly.
So I know we all need to be out there designing case studies and publishing and just talking. And that's the root of this podcast, is at least to be another avenue for sharing these stories and getting it out there.
Yeah, and maybe inspiring other therapists watching this to do some case studies, so we just get at least more little bits of data out there.
Exactly.
Right? It's not a huge N of 500 patients, but each case study does help, and it's kind of a reminder we need to look at our patients one by one, and are they getting them better, and give those anecdotes, and those patients encourage them to tell their referring provider how physical therapy helped them. I think is huge.
That's huge. And again, like I try to be a little bit more upfront now with clients or students who've attended my birth class. Like, if you leave me a Facebook review, that's the world we live in right now. That's huge. People are going to read that. And I strongly believe that if someone who's had a good experience sits down and takes that 5 minutes to say, this directly impacted my life, you might have just changed or saved somebody else's life, because they're going to read that and understand, I'm not the only one out here. I can get that help too. We're probably about out of time for today, but so lovely meeting you, Jake.
You too.
Thanks for coming over here.
On and on.
Yeah. Maybe we'll do another one. We'll pick another topic and do another one someday.
Absolutely. I will come back.
Don't worry. You don't just have a face for radio. I think it's working well on the film too. So, hey, cheers to all of you, and bottoms up.